NLN NEX Prep. Question 1. Which milliliter amount equals 3.5 L in this pronoun agreement item? Option A, 35 ml. Option B, 3,500 ml. Option C, 35,000 ml. Option D, 350 ml. The correct answer is option 1 liter equals 1,000 ml, so 3.5 times 1,000 equals 3,500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 2. During a quick NEX review of a parallel structure item, which word is closest in meaning to coherent in a study guide note? Option A, colorful. Option B, random. Option C, noisy. Option D, logical. The correct answer is option coherent means logical, so that choice matches the meaning in context. Colorful refers to appearance, not logic. Random means without order, not logical, and noisy refers to sound, not logic. Question 3. After checking the choices in an active voice item, which answer identifies the substance dissolved in a solution? Option A, solute. Option B, solvent. Option C, precipitate. Option D, catalyst. The correct answer is option. The solute is the material being dissolved. Solvent does the dissolving. Precipitate is a solid that forms in solution, and catalyst speeds a reaction. Question 4. If a capitalization check stem gives one clear clue, which choice most accurately summarizes the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed sets remove all content gaps. Option B, comfort never changes with practice. Option C, timed practice can build exam familiarity. Option D, the exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Timed sets remove all content gaps, is not supported by the passage. Comfort never changes with practice, is not supported by the passage, and the exam has no time pressure, is not supported by the passage. Question 5. When time is limited on a clinical scenario question, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the stem. Option A. The choice that directly answers the stem should be selected. Option B. The longest answer is automatically best. Option C. The first familiar term should be chosen. Option D. Any true statement is always best. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation. The first familiar term should be chosen, does not follow from the situation, and any true statement is always best, does not follow from the situation. Question 6. Given the information in a community clinic item, which sum equals 1/6 plus 1/3? Option A, 1/6. Option B, 1/2. Option C, 1/4. Option D, 1/3. The correct answer is option. The denominators are already the same, so add the numerators, 1 plus 2 equals 3, then simplify to 1/2. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 7. Suppose a similar student survey item appears on test day. Which word is closest in meaning to crucial in a study guide note? Option A, decorative. Option B, optional. Option C, doubtful. Option D, essential. The correct answer is option. Crucial means essential, so that choice matches the meaning in context. Decorative means for appearance, not essential. Optional means not required, not essential, and doubtful means uncertain, not essential. Question 8. While working through a timed wellness app set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, conduction. Option C, convection. Option D, radiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, convection moves heat through fluid circulation, and radiation transfers energy by waves. Question 9. Before choosing an answer in a practice timer item, which statement gives the best main idea of this passage? A patient education sheet used short sentences, headings, and pictures. Option A. Pictures make written instructions unnecessary. Option B. Long paragraphs are best for patient teaching. Option C. Clear formatting helps readers understand health information. Option D. Headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Pictures make written instructions unnecessary, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage, and headings reduce the value of information, is not supported by the passage. Question 10. A student sees this exam readiness idea on a NEX review. Which increase is shown from Monday 16 to Wednesday 24 in a simple practice chart? Option A 8. Option B 40. Option C 5. Option D 24. The correct answer is option. The increase is the final value minus the starting value, 24/16 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. One quick review practice problem tests this skill. Which dose volume gives 300 mg from a supply of 100 mg per 5 ml? Option A 15 ml. Option B 3 ml. Option C 30 ml. Option D 7.5 ml. The correct answer is option. Set up the proportion 100 mg, 5 ml equals 300 mg x ml, so x equals 300 times 5, divided by 100 equals 15 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 12. Several choices look tempting in a hard question item. Which word is closest in meaning to distinct in a study guide note? Option A, separate. Option B, combined. Option C, humid. Option D, ordinary. The correct answer is option. Distinct means separate, so that choice matches the meaning in context. Combined means joined, not separate. Humid means moist, not separate, and ordinary means common, not separate. Question 13. For this easy question nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, replication. Option B, classification. Option C, estimation. Option D, bias. The correct answer is option. Replication checks whether results are reliable across repeated trials. Classification is grouping items, estimation is an approximate calculation, and bias is a systematic error. Question 14. In a short mock test practice STEM, which statement gives the best main idea of this passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, orientation should never include stories. Option B, former patients stopped the program. Option C, personal stories can motivate people to participate. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Former patients stopped the program, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 15. Among the choices in a diagnostic set item, which answer identifies the group that does not receive the experimental treatment? Option A, sample. Option B, conclusion. Option C, experimental group. Option D, control group. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied, conclusion is the final interpretation, and experimental group receives the treatment. Question 16. Using the facts in a final review question, which average results from scores of 70, 74, and 78. Option A, 72. Option B, 8. Option C, 74. Option D, 222. The correct answer is option. Add the 3 scores to get 222, then divide by 3 to get 74. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 17. Based on the clue in a question bank item, which word is closest in meaning to evidence in a study guide note? Option A, proof. Option B, delay. Option C, rumor. Option D, habit. The correct answer is option. Evidence means proof, so that choice matches the meaning in context. Delay means postponement, not proof. Rumor means unverified talk, not proof. And habit means repeated behavior, not proof. Question 18. Consider this high-yield workbook page concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, trachea. Option B, capillary. Option C, artery. Option D, vein. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, artery moves blood away from the heart, and vein returns blood to the heart. Question 19. Near the end of a study notes review session, which statement gives the best main idea of this passage? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, quiet rooms increase noise. Option C, reducing distractions can improve study conditions. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage. Quiet rooms increase noise is not supported by the passage. And distractions are always helpful, is not supported by the passage. Question 20. Across similar revision guide nursing entrance questions, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A, graphs cannot show patterns. Option B, the graph shows a possible association but does not prove causation by itself. Option C, the policy must be ignored. Option D, a rising graph proves the policy caused everything. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. Graphs cannot show patterns, does not follow from the situation. The policy must be ignored, does not follow from the situation. And a rising graph proves the policy caused everything, does not follow from the situation. Question 21. Since only one choice fits the crash course clue, which for flow rate delivers 1L over 3 hours using a 15 GDT/ml set? Option A, 5000 GDT/min. Option B, 83 GDT/min. Option C, 333 GDT/min. Option D, 6 GDT/min. The correct answer is option. Convert 1L to 1000 ml, then use 1000 times 15 divided by 3 times 60 to get about 83 GDT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 22. From the information in an online quiz item, which word is closest in meaning to indicate in a study guide note? Option A, repair. Option B, borrow. Option C, show. Option D, conceal. The correct answer is option. Indicate means show, so that choice matches the meaning in context. Repair means fix, not show. Borrow means take temporarily, not show. And conceal means hide, not show. Question 23. At a testing desk during an answer key review, which answer identifies the organ that produces bile? Option A, kidney. Option B, gallbladder. Option C, liver. Option D, pancreas. The correct answer is option. The liver produces bile, which helps digest fats. Kidney filters blood, gallbladder stores bile, and pancreas secretes enzymes and hormones. Question 24. Inside a sample test science or skills item, Which statement gives the best main idea of this passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training may have improved compliance with hygiene practices. Option B, the refresher removed all risk permanently. Option C, hand hygiene cannot affect infection. Option D, training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently, is not supported by the passage, hand hygiene cannot affect infection, is not supported by the passage, and training increased infection rates, is not supported by the passage. Question 25. Through careful reading of a test bank stem, which increase is shown from Monday 15 to Wednesday 25 in a simple practice chart? Option A, 10. Option B, 25. Option C, 40. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 25 15 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.